5. Run.
Well, hello, everybody. Welcome to Healthcare for All Los Angeles and PNHP office hours. We are so excited today to be on with everybody talking about AB1400 office hours. We are, why is there a feedback?
I got rid of it.
Oh, okay. And then, so anyway, we have with us Shambi with on our leadership with Healthcare for All Los Angeles and DSA LA. We got Danette over there. She's in her car. So when she can safely share, we will have her share. Otherwise, she is with us in her traveling spirit, and she's with PDA along with Dr. Bill Honigman. Always good to have a doctor in the house. So Dr. Bill with PDA. And then we have Chung Sim Lim from Healthcare for All Los Angeles. Also Pana and DSA LA. She does it all. And then, of course, we have our webmaster, our Facebook liaison, Paul Newman. So super excited to be here. Paul, could you go ahead and pull up the CalCare principles, please, on screen share? Okay, so starting from the beginning, what is CalCare? CalCare is Assembly Bill 1400, also known as the Guaranteed Health Care for All Act. And then it's lovingly known as CalCare, get it? California Care. And this is a single payer bill. This is the solution to our, it says broken, I also want to say our caste healthcare system. We have a healthcare system that is, gives great care to the wealthy and often white, and subpar care or no care to everyone else. And this is a system where everyone in California would receive the same high standard quality care. It will guarantee healthcare as a human right in the state of California by providing comprehensive, high quality healthcare to all, and by all we mean all, like Medicare for All would do nationally. And we do have a national Medicare for All bill, HR 1976. Jayapal is the author of that. Woohoo! We love that bill. But we have CalCare here in California because we believe in supporting both, but we think we've got a real fighting chance with having the state lead the way. That's how it happened in Canada. It was one province, Saskatchewan, that passed single payer, and then it led the whole nation. So CalCare will lead the nation in the larger fight for healthcare justice. I do see that Mari Lopez from CNA, the California Nurses Association, has joined us. Hello, Mari. We're so happy that you're here. I was just about to just go over the principles of CalCare, and then would love to turn it over to you, maybe to take it from there. But really quickly, so CalCare would provide universal coverage. What does that mean, universal coverage? It means everybody in, nobody out, everybody regardless of race, sex, gender identification, country of origin, disability status, immigration status, marital status, income. Everybody gets the care they need regardless of the ability to pay. I mentioned earlier, it's a single public program. What is that? It's it just means that it is publicly funded through, it's like Medicare is publicly funded, and one entity, the government, pays the bill. So it's not socialism. Government doesn't run the care, it just pays the bill. So like Medicare, the government pays your bill, but you see, you go to privately private healthcare providers. So same thing here. The government pays the bill, you go to your favorite private healthcare providers. So this would be publicly funded through progressive taxation to cover all necessary care in California, eliminating billions in bloat and waste and saving people thousands on their healthcare costs. It would provide fully comprehensive benefits, which includes medical, dental, hearing, vision, mental health, drug rehabilitation, prescription drugs, long-term care, acupuncture, chiropractor, you name it, CalCare provides it as long as you and your doctor determine that you need it. All decisions about care would be made between, oh, I just said it, you and your doctor and nurses. Woo, nurses, not insurance companies. CalCare gives you the freedom to choose your care provider. We don't have freedom now. We are constricted to networks that are very small, and you call and you think one place is on your network, you show up, they're like, oh, nope, we're not in the network anymore, and you're stuck paying the bill. No more networks. Under CalCare, there would be you just go wherever you need to go. You would have the freedom to choose any doctor or hospital or facility you like. CalCare is free at the point of service. No more copays, no more premiums or deductibles. You arrive at the doctor's office, show them your CalCare card, and get the care you need. It's that simple. And just transition. Of course, this was written by the nurses. This is written by a union. So they are thinking about the people who work in, for insurance companies like, your phone operators. Well, there is a just transition for them. This bill provides funding and programs to protect and support any displaced workers in the insurance industry. And finally, the last principle is patient care based on patient need. No more financial incentives to avoid providing necessary care, including value-based payment models for providers. So with that, I would love to have Mari Lopez, there she is, with California Nurses Association, to just come on and talk a little bit about CalCare. Paul is monitoring the chat for any questions, and take it away, Mari.
Great, thank you. Thank you so much, Erica. I apologize for being a little late, folks. And I also have to share with you that I can only stay on an hour, Erica. I do have a meeting at 6 p.m., so I apologize for that as well, folks. But looking at everyone that's here and present, I feel like I should be the audience and listen to all of your expertise, because I don't think there's anything that I can add to this group as in terms of details. Maybe I can focus on a little on the campaign, but as far as policy is concerned, the political sort of dynamics and I should say environment that's present around this bill and around this issue, and the movement to expanding guarantee healthcare to everyone. This group is very well aware of much of that information. I would say as much as the California Nurses Association is. So what I would like to do is just maybe talk a little bit about the campaign going forward, and if there's anything that comes up regarding some of the policy or any questions about the bill, additional questions about the bill, I'd be more than happy to answer that. So currently, as you know, we are in full swing of what we've been calling our fall strategy. And the fall strategy is basically a strategy that encompasses they actually started around towards the end of July, and then to encompass the entire year leading up to December. Because as you all know, CalCare AB1400 is set to be reintroduced in January of 2022. And so the team basically came up with a plan of how to pressure the key players from now until that time when we're going to need their vote. And basically, when key players are folks who are in committees whose jurisdiction this bill must pass. That includes the Health and the Health Committee, the Assembly Health Committee. Of course, we're talking about the Assembly, as well as the Appropriations Committee. And so there are Assembly members in those committees that who we need to get on board. Some of them are on board, some not, but not all of them. And so the strategy is, okay, how do we get pressure to make sure that when this bill does go through those two committees, that we have enough votes to pass it? Because this strategy, again, is all towards getting the bill not only passed through these two Assembly committees, but it must leave the Assembly floor by the end of January, and before going and go on to the Senate before it actually will repeat that trajectory and then before getting to the governor's desk. So all of this work is with that objective to get the necessary support from the members on those two committees. And then additionally, to ensure that as we move towards the floor, as we prepare to get to the floor as well, that we have additional folks on there who are supporting the bill, who are being vocal about their support to encourage others who may still be sitting on the fence, who we didn't prioritize during this time, to inspire them to support the bill as well when it comes to a floor vote. So again, there were 33 Assembly districts that we prioritized, in the work that we're doing is to actually get their constituents to help us put pressure on them. And so that included a series of activities that would reach out to those voters. This was through text banks and through phone banks. And because because we're talking about hundreds of thousands of people, or thousands of people, so it'd be hundreds of thousands of people, we needed help. And so the part of our strategy was to call on our most ardent supporters and ask them for their help by becoming district leaders and really taking charge of this strategy, taking ownership of it, and helping to identify additional supporters within their network, as well as others that are inspired to be part of this and who want to help in ensuring that we pass a single-payer bill in California, and really, again, anchoring these 33 priority districts for the campaign to ensure that these text banks and these other activities that will follow are completed. And again, that all means just reaching these hundreds of thousands of voters. And in this case, I think it's 2.3 million, 2.2 million voters throughout California. So that again began in July. We're moving through that. We had 3 phases to it. We're now in phase 2. The first phase actually was laying the foundation and the groundwork and starting that campaign movement going, really laying out the foundation, if you will, of education for a lot of voters who may be new to the bill, may be new to the movement, not understanding that that there is a campaign out there, and then and really again just providing the district leaders with support, training, information, and resources that they need to again lead these efforts within their districts. Now we're in phase 2. Phase 2 is continuing the text banks that we've completed, and now we're moving into and now we're part of phase 2 is our series of phone banks, in which a lot of the folks that we reached out through these text banks, we're going to reach out to them by phone to make sure that they've actually signed the petition, and to see if any of them would be interested in joining the movement as well. Because as the largest, or I guess the most important objective for phase 3 is our legislative visits, and that's where we're going to meet with these electeds from these 33 Assembly districts to basically ask them, okay, where do you stand on AB 1400, and can we count on your support? So those are the 3 phases that right now that kind of make up the strategy at this time. And then again, and we're everything is in planning stages as well, or I shouldn't say planning stages, but we kind of, if we have to pivot on some of the activities and objectives that we're implementing, then we do so. And so a lot of that happens actually from feedback that we get from these district leaders as well. We've made some changes as a result of suggestions from the district leaders who gave us some really, really great ideas and to how we can have a more robust, I think, I guess that was more inspiring and felt that it would help us to garner more support from the voters that we're reaching out to. So it's really been an effort led by the district leaders, and it's been really successful because of the role that they played here so far. The campaign's going really well. If you've have participated in any of the events that we've had, the major events, the statewide events, hopefully that you were able to witness firsthand and feel the energy that's been coming out of these events, and the strategy that we're doing, particularly again as we engage the district leaders to take on these roles. The last statewide event that we had was the CalCare Fest, and we actually had over 200 people participate in that, which from across California, which was amazing for an online virtual event. And the individuals that participated some of them were new. Alex Lee, this was the first time he's ever engaged with the campaign, as well as Wendy Carrillo, two very key individuals, especially Wendy Carrillo, who sits on the healthcare committee in the assembly. She is a key ally, and that event helped solidify that for her with us. And so, we're really going to be counting on that relationship to help us push this bill through. So a lot of the what we're doing now is going to continue to build on that, again, in preparation for January, because folks always use the phrase hit the ground running, but it's a sprint come January 1st. Come the first of the new year, it is a sprint. We need to start vote counting. We need to make sure that we've got all the key elected officials on these two committees. We need to make sure that we have a majority of them here or their support. We also have to take the temperature of the room of the assembly chambers, I would say, with Brandon as well as Jim Wood, and of course the governor is going to be key in all that. But we really believe if we have the public behind us, this bill is very winnable. Because of everything that's occurred thus far, the will of the people has been heard clearly, and so I think it's a matter of making sure that these elected officials are reflecting that will and how they vote on this bill. So let me stop there and just see, because I threw a lot of stuff out there, and see if y'all have any questions.
So many questions. Some from the chat, which I'm just wondering if maybe I save those because we only have you for an hour and almost 30 more minutes. So maybe just save you, just ask you CNA questions and stuff right now. But Mari, we're still in a pandemic. COVID, obviously the nurses, obviously single payer supporters have seen how cruel our healthcare system is, because we've been in this fight for a long time. But COVID has really, I think, opened up, people who weren't really paying attention, as to the horrors of our current healthcare system, as to the numbers of people who are denied care, delayed care, and die because they can't afford health care. Why, I'm just surprised that all of our, Democratic legislators and the governor, that they're not already out there stumping for the bill. Does CNA have any insight on that, or how hard this fight is going to be on that level? It's just shocking because we're still in a pandemic, and this should be a no-brainer. What are your thoughts on that?
Yeah, I think what sometimes we forget, well, not so much that we forget, I think maybe it's just we need to be reminded is that, yes, while we're in a pandemic, we are, it hasn't shrunken the strength of the monster that we're up against. We're up against the healthcare industrial complex. And as you know, they're not taking any, I feel like they're not taking any responsibility in their role of the pandemic. We've seen it, since the beginning in early 2020 of this pandemic. Hospital closures continue to happen, denial of care continue to happen. They're still sticking people with bills. That continues to happen, and they're celebrating with these record-breaking profits. So I think it's really clear that they don't take any responsibility, nor do they assume any sort of like, I want to say, a sense of community or with the population that's affected, right? It's really, and I think this is a really sharp contrast to how providers view this epidemic. Providers, they saw this happening and they ran, right? Like firemen, they ran into the fire. The insurance companies, the pharmaceutical industry, hospital association, they saw the fire and they stood on the sidelines and figured out, okay, well, let's see, we can write this off, we can write that off, let's see, well, we can maybe just say this. So instead of, figuring out how they can help, they're trying to control their profits. And so I think this was really evident again in how we continue to see things not just continue as business as usual, but actually get worse. How do you close hospitals in the middle of a pandemic when you know that there were hospitals who were actually turning their parking lots into triage centers, and yet you do have these institutions these facilities that were well equipped to help out and contribute. Not to actually take the opposite approach. And so I think that, and the fact that our government didn't step in and put an end to that, pass some emergency policies that would prevent that, and turn these places into play, and kind of basically like take over and say, you guys don't seem to be, we're going to handle it from here, and then really again use these resources to manage the pandemic and to help and help people who are affected. I think again that was it was really telling for me on a person. I'm not speaking on behalf of CNA right now, but on my personal observation was just watching that and knowing that it made no sense. And then when they came out, I think just towards the end of the year, was fourth quarter 2020, when the first time that they reported their record-breaking profits, I was flabbergasted. I couldn't believe it, but it made sense as well, again, given the role that they've been playing. So I think in some cases the elected officials are hogtied in where there it's and I kind of understand but kind of don't, because I've been around elected officials for a very long time, and it's I've never understood the thinking behind that, but I guess there's self-preservation in some cases, and I think what happens with a lot of these electeds is like there's a desire to remain in office, and I feel like and so I have my understanding of that sort of thinking has changed a little bit, because I used to feel that, well, if your priority is self-preservation, this isn't public service is not for you, because right, public service is selfless, and so that's it's opposite of what that again that prioritizing your own survival is. But I think in some cases they think, well, if I'm not here, someone else gets voted in my place, and I can't do the good that I want to do. And so I think they're battling kind of like their inner thinking and wrestling with that, but also you've got this very powerful industry that is not, it's not just about the donations, but they walk in there and they say, look, we'll show you the number. You know how much tax revenue you're going to lose if you do this. You know how many people are going to be out of a job if you lose, if you do this. You know what the cost of it, this transition is going to be if you do this. So I think, you know, they go in there armed with a lot of those sort of like veiled threats, and I think a lot of elected officials struggle with this because I really believe a lot of them want to do the right thing, but they're hamstrung by what one side is telling them, but also what they know is the right thing. So they're trying to walk a fine line, but at some point, you know, there'll be no denying it, and so they're going to have to. They'll get courage at some point. That it just hasn't arrived yet. I really believe, folks, that this bill is going to. I'll be honest with you. I don't know if AB 1400 is going to pass. All right, I'm just going to put it out there. If you tell say anything to my colleagues, I'm going to deny I said it. But I will tell you,
Mari, we are live on Facebook.
Oh. We are live on Facebook. Well, I think it will. Okay, sorry. It will pass in the assembly. I don't think it'll. I think it'll take a lot to pass it in the Senate as well. I don't think it's going to pass without public pushing. Is what I wanted to say. It's going to take all of us to do it. I don't think if we don't get people to pass it. If we don't get people behind it, it won't pass. It's only going to pass with public will, making that, again, that comparison between what we have, the will of our elected officials and the will of the people. It's got to be, it's that struggle. And so it's a matter of, again, being able to take that public will and drive through the bill. And that's how we're going to win it. And if it's
Mari, I just first, I'm so great. Dr. Bill, I totally see you. You're next. But I just want to say, Mari, I'm so happy to have you on. I have loved everything that you said, your candor, your honesty. I've known you for a couple of years, your fight. I know that you fight with everything you have. So appreciate you and thank you for speaking just so straightforwardly and honestly. And I think everyone on here just loves and appreciates you. Put the heart emojis up. The CNA can see our red hearts for Mari. Just so appreciate you. But Dr. Bill, you were next.
Well, I know Mari for a couple of years, more than your couple of years, I think, Erica, but Mari is a true champion for the cause. And I was so relating to what you were saying about the frustration with these elected officials. And I personally have been a political junkie since the Vietnam War days. But when COVID hit, I mean, my personal frustration, you know, was like if I had any hair, it would have been on fire because you know, I was looking at these public officials who were not only, you know, like okay, so they were doing some of the what I thought was the bare minimum, like public pronouncements for, you know, making establishments COVID safe. You know, wearing masks, that kind of thing. But even with the vaccine rollout, but they did absolutely nothing to make testing and contact tracing. You know, everyone knows that you're not going to have an effective fight against the pandemic without universal testing, contact tracing, treatments of all kinds, including vaccines, right? But before that, like you said, the nurses especially went into the fight. You know, they didn't shy away from it. They went into it. Doctors, nurses, and technicians of all kinds went into the fight without adequate PPE, without adequate staffing, you know, which is fully within the power of these politicians to gear up. They could do this, you know, if they had to go into debt or something like that, you know, so be it. But they could have done this. And it was both heartbreaking and maddening at the same time. if the public does not get on board, if the public doesn't learn the lesson of COVID-19 and get on board for this bill, I'm not sure what it will take next to do that. But we need to, I think, amplify that message. We stared in the face of death with this pandemic, and to some extent, we're not out of the woods yet. So on this thing, we'll see if there's any more variants, and we have to vaccinate children, of course, under age 12 before it's suppressed enough that it's not really dangerous anymore. But you know, if we can't learn the lesson of this pandemic and say that something like this, you know, that healthcare justice, you know, a threat to healthcare justice anywhere is a threat to justice everywhere, you know, and we need to put this in place like every other advanced country in the world, you know, then you know, we don't deserve to live anymore anyhow. So all of us need to do that, and do exactly what Mari said, and support this campaign in any way we can. And if this particular effort's failed, fine, we'll go back to the drawing board and come at them again like waves on the shore. We will keep at it. So, but anyhow, thank you, Mari, as well. I'm a huge fan.
Thank you, Dr. Bill. And I think it's true, folks. And this is what we need to understand is that, and again, this is why the District Leaders Program is so important, because there's a lot of people out there suffering, right? And we know that, again, this healthcare industrial complex has really taken advantage, I want to say, of what's going on right now. And the vast majority of people are losing so much as a result of the pandemic, but not only of the pandemic, but the bad acting on the part of this healthcare industrial complex. And this is why it's going to take all of us. AB 1400 can easily pass this year, but it's going to take the public. The public has to come on board on it. That we have to put pressure on our elected officials, and it can be done. Even Governor Newsom, if we can get hundreds of thousands of people throughout the state to come out and to contact, email, send a text to their elected officials to sign that petition, and we've got thousands of signatures on that petition already, to let folks to put pressure on these elected officials to give us a single payer system. We will have it. We need to, again, it's going to take inspiring everybody who's been affected by the pandemic and those who are not. We just saw today. You all probably read about the entertainment industry coming. Their win. A lot of those have to do with benefits, and so if there's something like that that's taken off the table, then the focus becomes on working conditions, on pensions, on better pay. But those things like that are used as a leverage. And again, and it's just really ironic that you're negotiating hundreds of millions of dollars that you take from one industry you hand to another. It's not really going to the people, to the workers themselves, but it's going to another, again, an industry who's gonna see dollar signs, and basically that investment that's meant to take care of those workers in the entertainment industry, a lot of them are going to experience denial of care from that healthcare insurance company. Those benefits that were supposed to have been won are going to be lost for many of them, because again, they're not going to be extended to them at all. And so it is going to take all of us to do this. And so, everyone listening tonight and on Facebook and here as well, I hope that you do get inspired, because this can be done. It can be done. This is many of you know, as many of you pointed out, I've been in the single payer movement for many 20 years now. And I have not seen this movement I've seen a huge come in waves. We saw it with the ACA, but the groundswell around AB 1400 is incredible. It is amazing. The fact that we're reaching out to people who've never even heard of us, who just know that we're nurses, and asking them to support us and to help us transform our healthcare system and the fact that they are getting behind us is just amazing. So there's just hope in the air, and we will get this done.
Yeah, and I just want to say before we move to Sean, you're right, Mari. What we are up against, it's bigger than the oil industry. It's bigger than the fossil fuel industry. It's the medical industrial complex, as you said. It's not just health insurance companies. It's not just big pharma. It's not just hospital associations. It's not just medical supply industries. It's all of them together. We will never have enough money to defeat them. So we will defeat them by people power. So everyone must show up and continue to show up. And there are several ways we need you to show up, and they're fairly easy. We need you to contact your assembly member and tell them to support AB 1400. And I think Paul just dropped the link into Facebook chat. If you don't know your assembly member, he dropped a link where you can find your assembly member. Just call them up, state your name, your zip code. I'm a constituent calling that my assembly member supports AB 1400. The nurses are running text bank. HCALA, we're hosting one Monday night. My guess is Mari's gonna be there. I don't know, she's been at all of our Monday night ones. We got some good tunes. You can bring your wine, pop your beer. We text, we rock and roll with earthquakes. We have a good time. So come to the text banks. We're going to be doing canvassing with our partners at DSALA. I wanted to ask you, Mari, where are the nurses at on canvassing? Because I know they're pretty protective since they're nurses.
Yeah. Of course. So as you all know, California Nurses Association, National Nurses United, we're not currently endorsing any indoor events or activities at this time. As you've all probably read, we're taking a lot of caution with the pandemic. We continue to ensure, want to make sure that we're protecting everybody who's involved in the campaign, who's supportive of the work that we're doing. Right now, as we understand the pandemic, even if you're vaccinated, even if you're taking all the precautions with masking up and socially distancing and sanitizing, you can still contract COVID. So at this point, we're not there yet. I believe we will get there, and I think you're all seeing it as well. There's a lot of developments being made around a vaccine. I think we're seeing in some areas where people are vaccinating at higher numbers. We're seeing drastic reductions in the number of folks who are hospitalized. So I think we're going to get there. We're just not there yet. And when we do, that we're going to be the first ones out there encouraging folks to hosting events and encouraging folks to join us. But again, nurses just want to make sure that everyone's safe. Again, we have to protect each other. We have to protect those that care for us as well. And so at this point, we're still not encouraging social gathering. But again, we will get there, and we'll let folks know when that does happen.
So would love to maybe get some materials from CNA when we're doing our thing. Sean, you've had your hand up, and then Cheng Sim.
Yeah, thanks so much for making time tonight, Mari. It's good to see you on here. Thanks for being gracious with your time. Totally agree with you. If support's not mobilized, this bill not likely to pass. So we really do have to get active with each other. We have to take the threat serious from the organizations that are mobilized against us. But we all know that the demand for universal health care has only increased since the onset of the pandemic. The fight is now more urgent than ever and is emphatically a fight for class and social equity. But this is kind of like a bigger fight than even just our state. Like a way that I'm thinking about this right now is that CalCare protects Medicare from a corporatist takeover. Like really, single payer and traditional Medicare are social insurance. Marketplaces and Medicare Advantage plans are not. And we know that Washington corporatists are plotting to convert traditional Medicare into an entirely privately managed program, instead creating a Medicare advantage for all. So CalCare AB 1400 specifically calls for the elimination of these loopholes, which corporatists rely on for their profiteering. So we got a big fight ahead of us, but we're all in. Healthcare for All, Los Angeles, other chapters around the state, DSA, LA, other chapters around the state. We're all in with CNA on this. The local Healthcare Justice Committee, we've got people already participating as district leaders. So we're in on this. But my question, just something I'm curious about, and since I've got you here, we know the nurses are behind it, but what other unions are also in on this fight or have endorsed AB 1400? Just because this is a question that I get a lot. So I want to make sure that I'm speaking in the most knowledgeable way with other folks.
Right. Currently, our most active supporter is Unite Here, Local 11. They've been with us, and you've all, for those of you who've been aboard, who've been participating with us, have seen them on our events. They've spoken at many of our rallies, and so they've been one of our staunchest supporters. We've also we're working on additional unions as well. We are getting when we had SB 562, we had more unions at that time, and now we are trying to transition that support over to AB 1400. As you know, the pandemic has disrupted a lot of things for a lot of people. Even union members, a lot of union members lost their jobs during the pandemic as well, and have not been able to have not had work. And so there's a lot of struggles that are happening among union members still during the pandemic, and things that they're kind of dealing with as far as their priorities and keeping their members employed and maintaining their incomes and keeping their households intact. So we continue to work on that. I'm actually going to drop a link as to the number of unions that we have on board as well. But yeah, so it's been Unite Here. I know we've had also additional union members that have come out. The musicians union, I'm sorry, but I'm going to forget their local, have also been in support. We've actually had a lot of interest. And what's really interesting is that, the members, we've had a lot of interest from the members themselves, the line members, and that's where we're focused on at this point, to bring this information and to educate union members, because we feel that once we can build that support and build that foundation with them, then the leadership will follow as well. And that's where our focus is going to be. Yes, we do have UTLA and CTA endorsed as well. And so and I believe and for single payer, the issue of single payer, there are tons of endorsements, not just in California, but across the country as well. Getting down to the bills and getting them on paper. That's, sometimes those take votes among members. And again, during the pandemic, a lot of folks have not, they had other issues that they had to prioritize. And so this is kind of put on the back burner, but we feel that we are going to get a lot of additional endorsers as well for that.
That's awesome. And I want to give a big shout out to UTLA President Cecily Meyer-Cruz. LAUSD is the second largest school district in the nation. And she's a leader who really sees, how things like housing and healthcare, specifically Medicare for all, would be of support to, our student community, along with their parents and families. Chung Sim, I think you had your hand up before we lose Mari to her next meeting.
Yeah, Mari, I want to thank you so much for all the work that you've done over the years, and keeping on the good fight. And I want to publicly appreciate that you spoke the truth, which is that we won't win AB 1400. We don't fight and organize and mobilize for it. That's just the, the truth. So I want to urge everybody out in Facebook Live land, you're watching this, you want AB 1400, you got to come organize with CNA, DSALA, Healthcare Justice Committee, HCALA, everybody, Dr. Bill right there, organizing to win AB 1400. So come to our websites, or, Paul could probably put the links, share the links on Facebook Live. Contact us, come join us. We will be canvassing outdoors, tabling to gather letters from constituent letters urging their assembly members and state senators to vote yes to pass AB 1400. We're doing it. You gotta come join us.
Yeah, so on that note, thank you so much, Tengsim. We have at hcala.org, we have a calendar. We're going to list all the tabling events. DSALA is going to be running some, Feel the Burn San Fernando Valley is going to be running some. So we are working in solidarity. We also, at our website, we have a great toolkit under Take Actions. We include the nurses toolkit. So everything that the nurses are doing, from their text breaks in Spanish to town halls, you name it, we have it on our toolkit. So hcala.org. Mari, you have 6 minutes left. First of all, let me just ask, are there any other specific questions for Mari before she leaves?
And if while folks are thinking about that too, I just want to just add to what Chengsa was mentioning, it was talked about as well. Well, folks think about, remember and recall these large social transitions that we've had in this country. And folks may recall individuals that were behind it, like Martin Luther King, or for civil rights, and Lyndon B. Johnson. But those folks did not make those decisions out of altruism. They were pressured by the public. It was the public that called for these changes. And this is, again, how we are going to win AB 1400. It's got to come from the public pressure. Again, even the New Deal, that wasn't done by a single president. That was done by the public pushing, the public calling for change, for support. And this is how we're going to do it, folks. We could have AB 1400. We could have CalCare. We could have single payer. We could eliminate insurance. We could reduce the cost of pharmaceuticals. We can create hospitals in places that we need them, right? We can have more. We can have all the doctors and providers that we need them in key locations, and really prioritize our health as a population. But we all need to get behind this. It's going to happen because of every single person on this call, every single person who is paying attention to this issue and who's listening to this. If we got together, we do this together collectively, we're going to pass this. But we need all of you to step up. We need all of you to come and make your voices heard. We need all of you to reach out to your elected officials and tell them that this is what you want. This is how we are going to win CalCare.
Thank you so much, Mari. I don't see any other specific questions. So just want to thank you again for coming on. Really appreciate it. I'm sure we'll have you on again. And yeah, guys, show up Monday night. I'll be hosting the text bank, probably with Mari or Phil Kim. We'll see somebody from CNA, and go to CNA's. What link do you want to give out, Mari?
Oh, the Medicare for All.
MedicareForAll.org.
Yeah, I'll put that in the chat.
Okay, MedicareForAll.org. Excellent. I know we have some other questions. So we're going back to the beginning. Sean, do you want to articulate Jeffrey's question and take a stab at that?
Sure. And, this can just be a starting out point, and then everyone else is welcome to jump in. But Jeffrey T asked, what is the cost of Canadian and Taiwanese health systems, which are universal single payer, compared to the US? So if it's all right, I'll share my screen real quickly because I saw this recently. And I do have the ability to share. So here we have US spending compared to other wealthy nations. You see that top line, the US sitting well above others at 16.9%, creeping up towards 20%. That's really significant. Taiwan and Canada, Taiwan spends 6% according to the Commonwealth Fund. Canada spends 10%. So we have a drastic difference. You know, we're spending well above twice what other nations are spending, if not more. And these are wealthy democracies. California's, for reference, is about 13% of our state's economic output. But focusing on these comparisons, while meaningful, I think misses a greater point, which is really what is our productive capacity and what is it being used for? So what we see is really this large amount of spending is actually going to a form of rent seeking. It's essentially charging us a lot while not giving us something. It's charging us for our good health. So we have the productive capacity because we have 416 hospitals in California, 68 of which exceed exceptional standards of care. So these facilities exist to provide us excellent healthcare. And we're paying for quite a lot, but we're not getting that care really as a whole population. So what we really need to see a commitment is realizing our productive capacity, which is all of the capabilities and production linkages that, you know, a society's ability to produce goods and services, and commit it to society's welfare. And that's what AB 1400 does. So, you know, again, we've got these 416 hospitals. We've got 281 universities and colleges. California is the 5th largest economy in the world. But all of that wealth, all of that knowledge creation, all of that medical infrastructure means nothing if so many of us are locked out of it. So really, AB 1400 makes the moral case that these things have to be committed to serving our good and welfare universally. And that's what it gets down to. So yes, we're spending twice what other wealthy democracies are spending, but really it's about our productive capacity and what we're using it for. So Jeffrey, if you're still on, I hope we answered that question for you. And we can do this, and we can meet what other countries are doing.
Thank you so much, Sean, for that. And also, I just want to point out, Taiwan really handled the pandemic extremely well from the very beginning. And, this isn't the first pandemic. It's not going to be the last pandemic. And in order to be prepared for one, you have to have preparation ahead of time. I know Maureen has the figures, but there were, I don't know, thousands and thousands of respirators that we had in California that took about, $5 million a year to maintain, that Governor Jerry Brown sold. So when the pandemic hit and we didn't have respirators, because profit was put above the health of the people in our state, the health and of the people in our country. And so this is something that AB 1400 will bring back, is public health. And, it does cost money to prepare for an emergency. You have to have the things, you have to have them stored, you have to have them maintained, but it's a small cost. But yet we've gotten to such a place where even, when you have these numbers people like looking to squeeze every penny for profit, these small costs are done away with, and then emergencies hit and we're not prepared. So, right. So it costs hospitals to have extra beds that aren't being used so that they're there in an emergency. The way the hospital associations are running things, they're not about to have unused beds. They run themselves like a hotel. when the bed is full, they make money. And when it's empty, they don't. But AB 1400 does away with profit incentive. And it brings in, well, what is public health? What is public safety? Let's prepare for that. Let's pay for that. So you see patients, people above profits with AB 1400. I see your hand up, Dr. Bill.
Well, thanks. And I hope Sean's slide was really excellent. It shows those incredible costs. And I think, really, sorry you had to go, but I think what he was talking about was, say, cost compared to, output. Like, what are we getting for all that expense, right? So, so if I can share, here's another way to look at that, is this slide, which I've shown in this form before, but you can see here all these countries, including Canada, which is circled here, and all these other advanced countries in the world. This is life expectancy compared to
watch out for a kitten.
health expenditure. Oops.
Hold on.
There we go.
Okay.
Okay. So this is life expectancy compared to health expenditure. And so you can see that we're an outlier on cost, right? We spend so much more, and for it, we get so much less in terms of life expectancy, okay? So we don't get to live as long. So we're horribly inefficient. If Gina Harris was there, she'd say, yeah, it's the spaghetti, the spaghetti diagram, which is this other slide I'll share in a minute. But this also shows how poorly we did during COVID. Here's the year from 2020 to 2021, where our life expectancy dropped. If you happen to be a Black male in the United States, it's horribly worse. I mean, just tragically, unjustly, inequitably worse if you're a Black male in this country, and Black women and all minorities, obviously. And none of these countries had those horrible drop-offs in that year, okay? They did not. They had deaths, certainly not nearly as many as we have had as a result. And that's what Madi was talking about, that hugely disappointing response from our elected public officials. One of the principles of civilized societies is that public officials take responsibility for public health. What a concept, right? That did not happen in this country. That did not happen in California. What we got is this, okay, where at this point there's 724,426 total COVID deaths. We are the gold medalist country of COVID deaths. In California, 70,778 COVID deaths. That's huge. That's huge. It's a huge number. This many people would be alive today. 28,311 people would be alive in California today who died from COVID if we had AB 1400 passed. That's not me saying it. That's this distinguished panel of health experts that published their reason for saying that in the Lancet journal back in February of this year. And why is that? That's because we have this, Gina's fabulous description, the spaghetti diagram, where somebody thought the best way to pay for healthcare in America and California is to throw spaghetti on a wall. And you've got all of these agencies that have to be satisfied. Give me your money, give me your money. So when you submit a health claim here, the bill is paid here, you have to go through every one of these hoops and barriers to get your bill paid. In Canada, it looks like this. It's standardized, it's transparent, everybody knows where the money's going, there's no secrets to it. This is not just waste, it's fraud and abuse. They're abusing us because this is an extortion business model that says, You don't need to know. This is the way the mafia works. You don't need to know where your money's going. You don't need to know that. All you need to know is that we will maybe save your life if you throw all your money at us. That's what big insurance is doing. That's what big pharma is doing as well in this country compared to Canada, Taiwan, and all the advanced countries in the world. We should be sick and tired of this stuff. We have to show up, stand up, and speak up, and vote, and make a difference. I also wanted to, I think it was James who asked the question about costs at the back end. You know, if we invest in healthcare, like with AB 1400, we lower the costs overall. Guess what? People fill their prescriptions, take their medications, don't end up in the emergency room. They get dental care, don't end up with dental infections in the emergency room. Guess what happened? We save money. It doesn't cost more. All the economists, every economic study has shown you save on the order of $1 billion for every million in the population. 1 billion for every million. How many people do we have in California? What's our population right now? Anyone know? I think it's about 40, 38, 39 million people. We will save about $40 billion in California per year when we go to AB 1400. Here's a study that was done by a group called the Lewin Group back in when it was proposed in 2004 in this bill, SB 921, that was Sheila Kueh's bill. This shows the incredible savings to businesses, all businesses, public and commercial businesses. I don't say private businesses because the only thing that's private about commercial businesses is the backroom deals that they make. So I call them commercial. So public versus commercial businesses. But you can see they all save money. What's a public business? Schools, city councils, county government, state government. Those are public institutions. They save this kind of money too, okay, per year, per employee. Schools have a lot of employees. What could schools do with that savings? How about teaching kids? How about building affordable housing? How about renewable energy for California? Why aren't we doing this already? Why didn't we do it in 2004? Because we haven't had the political will. So Amadi is right, Ching Sim is right, Sean is right, we're all right in this group. We have to show up, speak up, stand up, get people to vote, and do it now. Thanks.
Thank you so much, Dr. Bill. Just wondering if there's, we have some other people here on Zoom, Danette, Dennis, you guys are here all the time. You're in the fight. I don't know if there's anything that you want to talk about the bill, but if you do, I'd love to offer you the mic. Danette, I see you shaking your head, so maybe starting with you.
Yeah, I had put a comment in earlier about our assembly member who is Stephen Choi, and he is just pretty much useless in every way, shape, or form. And I have the same issue with my congressperson who is Lou Correa. Thankfully, we have a challenger this year for him because he is also totally against Medicare for all. That's really the only hope I have is getting these, Dinos and corporate Dems out. That's really the only way I see around this. Because no matter what you say, I've been meeting with Correa's staff member for 2 years and Correa a handful of times. And he already has his mind made up the minute you get in the office or on the Zoom. He's basically got his arms crossed and is not listening to anything you say. So at that point, I don't think that anything you say is going to convince them otherwise. And I think the only way forward is getting those people out of office. And however we need to do that, like Dr. Bill said, get in the streets. We have to start doing that a lot more. And we have, that's the only way I can see around it.
So, yeah, that's really interesting that you raised those points. And I have a couple of thoughts on that. So one, I think strategy wise, it's really good to know who are not movable on this. So don't waste your time on them and then go and text bank help text bank for another district, show up, right? So that's really important that you raise that, because so that way, you know what, like, that's the 20%, we can't change their mind, so let them go in the small amount of time we have, go for the low hanging fruit, the medium hanging fruit, and do what we can. Also, yeah, your point on them getting out of office and being primaried. And the thing is, I think that, like, and I'm speaking to Democrats right now, you have to, how much courage do you have? Because the game that I see that's played over and over ad nauseum is they'll be like, yeah, but do you want a Republican in there? And they will, and then it'll be, so they will have their worst Democrat. And like, so this is the game that's played. So, it's a rhetorical question. It's something to think about. How much courage do you have? How far are you willing to go? Because right now, this game that we're playing, I see Democrats falling for it over and over. It's a choice between, I don't know, a pile of poop and then a pile of poop with vomit on it. Like,
actually, there's a South Park episode where they had two candidates. One was a douchebag and one was a shit sandwich. Sorry.
Well, so there you go.
There's the choice.
And this is what happens. And they're like, and then the Democrats are like, well, I'd rather just have the douchebag. And so then they line up and support it. And it's like, nothing's ever going to change. And I'm at the point of like, forget about the D's and the R's or whatever is after the name. What policies do they support?
Absolutely.
And let's stand up on policies. But thank you so much, Danette, for sharing.
Absolutely. And I have a very low tolerance for all of that BS that goes on, especially with, like I said, my congressperson, he's horrible. He's taken over $1 million in pharmaceutical and insurance money, and also fossil fuel. So, I mean, it's just so blatant. And anyone that doesn't know that isn't paying attention, because it couldn't be more obvious, that they are in it for the money, and that's it. And nothing you say is going to sway them. And that's why I think we need to get them all out. Easier said than done, but we at least have a challenger for Korea. Maybe we get other progressives in there too to get them out. So.
Yeah, and on that point, when you say anybody who can't see that is just blind, and I would say, this is where Democrats do the same thing they accuse Republicans of. Like, I see the Democrats saying, I don't know how these Republicans can't confront their legislators on this or that. I mean, it's so blatantly wrong. Well, what happens is people are tribalists, and then they become willfully blind. And it's like literally just, well, I just have to have my team win and I'm going to close my eyes. So this isn't a game. This is life and death. It's very serious. And, how hard are you willing to fight? Bernie Sanders used to say, are you willing to fight as hard for the person you don't know as you're willing to fight for your own self, for your own family? I did a presentation to a wonderful group. Dr. Bill, you probably know it. I'm going to mess up their name. I don't know. Interfaith Community for Justice and Peace. Like, they've been around forever. And I got to do it with Dr. Song. Dr. Paul Song was on, and he did this amazing presentation. And part of it was talking about what is it? Not Medicare, Dr. Bill, but Medi-Cal. And then the other term for it is that everybody else has in the nation. Like, Medi-Cal is what Californians call it. But
Medicaid.
Medicaid, thank you. So he was talking about Medicaid and Medi-Cal. And basically this is our medical apartheid system, where, again, those who can pay for it and are often white get great care. And those, in Medi-Cal and Medicaid are not getting the same health care. And AB 1400 ends that tiered type of care. And he talked about how you'll see all of these legislators out there very proudly stating, and I support the Medicaid expansion, as if I'm like this great progressive legislator. And he said, I'd like to see all of those legislators be on Medicaid. I'd like to see them be on Medi-Cal, and let's see how much they feel like, you know, they're heroes and champions. And this is the thing, Danette, in addition to the obvious that, you know, our legislators are taking, whether it's contributions, gifts, or whether their spouses have foundations and charities that are being funded by the medical industrial complex and so forth, and their children get hefty salaries to run them and all of that kind of stuff. You know, they get basically socialized healthcare that's really good for the rest of their lives. So they're not experiencing what everybody else is experiencing. And I also just want to say to those who think that they have great insurance and who can easily pay the deductibles, the premiums, the copays, the out-of-network costs, the uncovered lab costs, you know, I just want to say that all of those things are on a forever rising. I mean, they're just like, those costs are going to be forever rising. So if you think you can afford your premium and deductibles right now, you haven't hit the ceiling.
It's not sustainable. It's not sustainable.
And they're going to keep rising and rising and rising and rising. And for the very wealthy, that doesn't make any, you know, doesn't make that much difference to. I mean, wouldn't you rather go on a trip to Paris than pay these bills? So they are forever rising. And so you want to be in this fight now so that we all have high quality healthcare. And AB 1400 makes it so that the janitor and the governor have the same high quality comprehensive healthcare from before we're born, from prenatal to end of life. Dr. Bill, I see your hand.
Oh, I was just going to chime in. If folks aren't familiar with the great movie, the Healthcare movie is aptly named. It was produced by a couple of wonderful, very kindly movie makers from Canada. And it contrasts American versus Canadian healthcare. But they talk about how we got to, you know, healthcare in America the way it is, and a lot of the history. Your description, Erica, sounds just like what the late Senator Ted Kennedy used to describe, that he went through healthcare issues with, I think his son developed bone cancer, and so he had to go into, you know, a pediatric oncology service with his son, and saw many families with young children being treated. And he felt it just wasn't right that a lot of them were, you know, were having significant financial difficulties just to get their child treated for a, you know, what's no fault of their own, you know, an incredible burden on any young family to have a child stricken with cancer. And he said he just didn't see how we shouldn't have a system like they have in Canada, where everybody gets that high standard of care. You know, he would sit there and know that he had the high quality afforded to him as a member of Congress. Why couldn't everybody in that room have that? He knew they could all have that, just like they do in Canada and, you know, other parts of the world. It was doable. He was trying to do it in the mid-1970s. He got blocked again, you know, all of that history. It's a remarkable film. And you know, it was interesting. We had a town hall through Progressive Democrats America today with progressive talk show host Tom Hartman was our guest, and he wrote a book. He's got a new book out called "The Hidden History of American Healthcare." I don't know if that shows up. Green screen. There it goes. Okay, but he talks about those outcomes, those quantifiable outcomes, like we talked about longevity and infant and maternal mortality as being, kind of what we want out of healthcare. But in America, we're performing poorly on other things that aren't as easy to quantify, like, for example, teenage pregnancy, depression, suicide, homicide. All of these things are addressed by healthcare in other countries. Even poor performance in schools by children happen in this country as a result. So it's not just whether we can, live or die. It's also how we live, when we're alive in this country that's suffering as a result. And so it's a much bigger question, and it has to do with not how wealthy we are as a country, but the gap between the very wealthy and the unwealthy in this country. And that gap, like someone like Bernie Sanders always talks about, the gap between the rich and the poor in this country is what's driving it. And that's what we need a kind of holistic approach to economic justice overall to fix this problem. And they have that in countries like Canada and Taiwan, where they've decided that it's not right to have billionaires and CEOs of companies, making hundreds and thousands of times more money than working people that work for their own companies. So the only way that we're going to be able to fix this is to get more people engaged in the struggle, and through forums like this and other things that we can organize and get people involved in. So sorry if I went off on a tangent there, but I think it's important. And if you can check out that movie, the healthcare movie, it also tells the story of Tommy Douglas, who's a very revered political personality in Canada. He was, turns out, was a preacher in Saskatchewan, and I think we brought up early on, even I think you brought up, Erica, about how Canada started it in Saskatchewan, and it spread across Canada. That could happen in California. It was brought up in her town hall meeting today that it's actually be much easier to spread across America because we already have a single payer system in place. That's called Medicare. It just happens to be for seniors and disabled. They didn't even have that in Canada. So all we have to do is get them to lower the eligibility age. Once it's established in California, it'll be easier to do that. But the story of Tommy Douglas is remarkable and worth watching the movie. And then to see how much more secure and happy, Canadians are with their healthcare. It doesn't impact their job choice. They can raise a family. We all have to worry about climate impacting future generations. And so everybody ought to be on board with that too. But let's at least fix healthcare, in the meantime, while we're working on getting renewable energy, yesterday.
For sure. And I love your tangents. And then Danette, I see your hand, but I just want to say, thank you for sharing that story about Ted Kennedy. When you hear about a politician that actually has the heart and tries to do the right thing for the people, it's refreshing. I remember, hearing about how President Biden's son, when he suffered from cancer, that his medical bills were so high that he had to get a loan from President Obama. He was going to have to sell his house to pay the bills, and he got a loan from President Obama to pay that bill. And so it's just like, and that's why it's just more heartbreaking that Biden's not front and center on national Medicare for all, because with all due respect, not all of us are friends with the president who can float us a loan to pay our medical bills. And so growing up Catholic, as we would say, may Ted Kennedy rest in peace. So Danette, your hand is up.
I just wanted to bring up a point. My husband works for Mercer. They're a health and benefits consulting company. I'm sorry, honey. Sorry, I wasn't supposed to say the company. Health and benefits, the company, and he's worked there for 20 years, and he sees the rates that their clients, the rate increases that their clients get year over year, and it's really not sustainable. I don't see that that's going to be a successful business model after a while, just because, barring all of the fraud and abuse that is in the system, he sees it, every day, that it's just not a sustainable system. So.
Thanks, Danette. Let's see. Oh, I think Dennis had to drop off. I was going to give Dennis a chance at the mic because he's in the fight, and he's with DSA LA and Fieldberg San Fernando Valley, and is always with us at Healthcare for All Los Angeles. Paul, you always run our technical side, but just want to give you a chance at the mic. Is there anything that you'd like to weigh in on this conversation tonight? And it's okay if not. I know I'm putting you on the spot. You don't have to.
Well, I'm encountering, I did a text bank, and excuse me, I encountered a lot of really interesting things. Also, I attended Dr. Bill's PDA healthcare town hall, Medicare emergency town hall, that is. Tom Hartman was there, but there was a woman who said that she was concerned about, and I spoke with Sean Broadbent about this too, about people from other states flooding in and driving the cost of healthcare up who need healthcare. In other words, this would be like a sanctuary state, but at the same time, she was concerned that it would drive it up and it wouldn't work. So I'd like to know what some of your thoughts are on this.
So first of all, you can't drive in and partake. You have to be a resident of California. So that's the first part. Oh, and then I think you froze there, Paul. There you are. Or maybe you were just super still. He's alive. But yeah, so does that make sense? Like you have to be a resident of California. And, I'm not sure exactly, how that's established. I'm thinking they're going to use the same system. There's our UC university systems, right? So there's a certain rate for residents and then certain rate for out of state. For my kids to go to my local public school, I have to prove my residency in the district, right? So there'll be some, way to show that you are a resident. Now, however, we do cover our unhoused neighbors as well in AB 1400. So again, I don't know what the test is to show residency, but you have to be a resident. So anybody saying that they're just going to drive over the California border to get healthcare, it doesn't work like that. The other thing is when people start saying, oh, well, there'll just be a bunch of people moving here then, and that'll drive up costs. Well, you have to really think that through. You know, if you have children at a school and you're employed, are you really going to pick up take them out of school, lose your job? I mean, you'd have to have a job. I would think you would want to have a job wherever you're moving to. So it's not that easy to just pick up and move. If you are picking up and moving here, well, that's more taxes that go into the system. So, you know, it's kind of, you know, it all kind of works. So I guess that's my answer to that question. And then Dr. Bill, I see that you might have an answer to that as well.
Sure. Science. My answer is science. So it's hardcore social and economic science. It's been studied over and over again. That's what economists do. They study labor forces, they study supply and demand, they study social migration as a factor. And so they look at that and have looked at it every time it's been proposed. Would people move to California? You know, maybe they will. But as Erica said, if that actually means more tax revenues, that means more expansion of the entire healthcare sector of the economy. I mean, we're talking about recovering a third of every healthcare dollar, a third. Okay, so like I remember about 15 years ago, they built a hospital here in Orange County off of the 405 freeway that I worked in for a while. And they told us, they shared with us that it cost $1 billion to build that hospital. I feel like Dr. Evil, $1 billion. But it cost $1 billion to build that hospital. That's one hospital in California, cost $1 billion. Now, can you imagine having a third more, you know, 300 million more at your disposal? So that's what we're talking about. Expanding the revenues in healthcare to build more hospitals, to hire more staff, to provide care to people. If they want to move here, great, terrific. We will flourish as a result. We will take care of sick people. You know, bring us, you're tired, you're bored, you're hungry, and you're sick. We will take care of them. And California will become, instead of the 5th largest economy, will become the 1st largest economy in the world. And, you know, I guarantee that. And every economic study that's ever been done, and I can track these back to the year I graduated high school, which was 1971, when it was done for a bill that was proposed by then Speaker Willie Brown, Speaker of the Assembly, who proposed the same thing, universal health care for California, in 1971. And so economic studies have been done over and over and over again, have said that's not a factor to discourage it, that's a factor to encourage it. So that's my answer to that question.
You know, also that reminds me, so the public school systems in California in the 1950s were some of the best in the country. And it's what made California to be the 5th largest GDP in the world. So in the 1950s, everyone was moving here for the public health care or for the public school system. And so industries opened up here because it was attractive. So this is a positive thing. Also, just to continue what Dr. Bill is saying, AB 1400 is a job creator and a revenue generator. So it creates jobs because we would be building hospitals, we would be building health clinics. One of the things AB 1400 does is it prioritizes healthcare in areas that are right now depleted of it. So a lot of rural areas, a lot of underfunded cities and neighborhoods, right? So if you go into Beverly Hills, you have you have Cedar-Sinai Hospital, you have all of these doctors' offices. but in, you know, other areas, you know, you don't have anything at all. And so when people get injured or sick in these areas without clinics or hospitals, so they say delayed care is denied care, right? So the longer they have to travel to get, you know, medical care, the worse their injury or their illness can get. And so there would be the building of and reopening of hospitals in these areas where they have been shut down. So what does that do? Okay, so now you have to have the staff for this. You have to have the doctors, you have to have the nurses, you have to have the receptionists, you have to have the janitors. But it's not just that, it goes out, then you need the restaurants and the stores. And so it creates jobs, and it builds revenue. So yeah, thanks for that. And thank you so much, Paul, for sharing that question that you got, because I've heard that question too. And so I think it was really good to visit it. So thank you so much.
Yeah, it's economic expansion. It's a jobs bill. It will create many more jobs. It's a jobs opportunity. You know, we need to train more people in the industry. So, you know, clearly, you know, that has to expand too. And guess what? That's in the bill. It's written in there. So, you know, that's all been recognized. It's all been, the working model for it is in there.
So I saw, Dr. Bill, what you put in chat. You wrote, need more money for schools, housing, renewable energy. Answer, AB 1400. Need more money for high-speed rail. Answer, AB 1400. The reason why AB 1400 is the answer to needing more money for things like housing and greening our economy is because AB 1400 saves money.
And
Dr. Bill said it earlier, it would save California $40 billion a year. Did I get that right, Dr. Bill?
Absolutely. 1 billion for every million in the population per year. I mean, you can extrapolate that down to your city. You know, what city do you live in? What's the population? You know, if you have 100,000 people in your city, like, I don't know, but like Irvine, I think city of Irvine is about 100,000, 150,000, I don't know, something like that. That's $100 million a year. Okay, so why aren't we doing this? Why aren't all those cities, you know, saving that kind of money every year and applying those savings to other things that they need? Doesn't make any sense.
I think that we should do like a commercial, like a car commercial. You want more jobs? You want more money? AB 1400. So, Paul, I see your hand is up.
Yeah, I just had a couple of questions. One, really, this should be this is what our campaign should be about. It should be about jobs. We need to sell it on that, about jobs and how it's a job creator. And it's a huge one. It's almost equivalent to the stimulus package. That's the first thing. But the second thing is, I was in the countering of my, at the CNA, I was text banking, which I recommend everyone watching this try. It's really fun, especially at our event.
Paul, will you drop the link after this?
Yes, I will.
We're text banking tomorrow night, Monday, those of us here, and Paul will drop the link. But sorry, Paul, I interrupted you. Go ahead.
Oh, no problem. No problem. But the other thing is, there's a lot of people who are frightened of the word socialized medicine. It never works. I was getting a little bit of that, not much. But I mean, I'm sure some people are interpreting it the wrong way. And it really, as you said, it isn't. And if you could repeat that, I think that would be important, because it really isn't socialized. It's just it is a social program, but it's not a social, you know, government thing. Because you say the only people that everything else runs the way it is, right?
Yeah, so I think people, and this is, they don't understand, the difference. So socialized medicine is what our veterans have. That's our VA. That's socialized medicine. It's what the United Kingdom has. I think it's what like Denmark has. So socialized medicine is when the government runs and operates the healthcare system in this case, right? And so this is not socialized medicine. It's just, what would you say, Dr. Bill? Socialized paying of healthcare. So the government pays for the healthcare. They actually pay the bill, but you go to your private providers for healthcare. The government is not running the hospitals. The government is not paying the doctor, what do you call it? Like office stuff. Like the doctors run their own offices. So it's socially paid, but privately delivered. And I see Dr. Nguyen has just joined us. Dr. Nguyen, we were just talking about, if you want to, chime in, we were just talking about some people think that AB 1400 is socialized medicine, and they become very frightened of it. And I was just saying, it's not, it's just the government pays for it, but you go to your own privately run hospital or clinic or doctor office. Is there anybody else that wants to weigh in on that?
I heard the comment on Facebook, and then I said I have to join in because
Oh,
that's something I
good.
hear all the time, and I think you answered it perfectly. It's publicly funded but privately delivered, right?
There
So
you go.
your doctors, your nurses, they all are still going to be working privately. They're not employed by the government. They're going to still have their employers, and it's just going to be that the source of money comes from the public instead of it coming from the spaghetti soup that Dr. Bill so eloquently showed earlier today.
Oh, I'm so glad you jumped on. That's perfect. Publicly funded, privately delivered. Thank you so much, Dr. Nguyen. And then Dr. Nguyen, we only have 15 minutes left. And I guess since you've been seeing us on Facebook, we're passing the mic along. Anything you want to share about AB 1400, and just maybe for those who don't know you, maybe just give an introduction?
Sure. So my name is Dr. Richard Nguyen. I'm one of the pulmonary and critical care doctors. I'm still practicing and a huge supporter for AB 1400. I might try to do the best I can, following in the footsteps of all these amazing people that you see in front of you. One thing that I wanted to say was, this has been, and I've said this multiple times, this has been probably one of the most challenging years of my life with the pandemic and everything that we're going through. And, we've, as healthcare workers, frontline workers, we've been put in a position so often this year where we are unable to care for each person to the best of our abilities because of their insurance status, or because of their lack of insurance, or for whatever other reason. We get put in these positions. And when we go through medical school and all of our training, we're always taught, and this is something that I believe everyone in the medical community holds very dearly, is that you treat every single patient like they are your loved one. You treat everyone to the best of your abilities. And unfortunately, time and time again, we are unable to do that. And particularly during this year, it's been so prominent because of the pandemic and the situation that we're in. And, as the year has gone by, as this year has progressed, the amount of burnout that I see, not just from physicians, but from nurses, respiratory therapists, x-ray techs, you name it, from top to bottom, we see it so much more now, because people are they're fed up, they can't work the way that they want to work. And so, one thing that you have to keep in mind is that all of that will be so much better with AB 1400. With CalCare, you'll be able to treat every single patient like they're your loved one. You'll be able to give them all of the benefits and the long-term care and all of the rehab that they so deserve to get better from whatever illness, whether it be from COVID-19 or whether it be from cancer, whether it be from a heart attack, right? And so when people ask me, how are we going to be able to take care of all these people without insurance, blah, 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 blah. Well, guess what? You're going to have a lot more providers here. You're going to have people who enjoy to work, enjoy to see every patient on a daily basis, and don't have the burnout that we suffer from today. So the medical community is just going to become so much more joyous place to work in. We're not going to have to worry about, all these other issues. That's one thing that I wanted to chime in about.
Thank you so much. I think it's important to hear a perspective from, from doctors and doctors who are in it right now. In our society, we do hold a reverence for our doctors. So thank you, doctors, so much for being here and being in this fight and taking the time to share with us. We really appreciate it. I know one of the things that I was so shocked to learn, and Dr. Nguyen is on Healthcare for All Los Angeles leadership team. And so I've seen him speak and worked with him for, I don't know, probably coming up on a year now. But I remember one of the things, I don't know why this really stuck with me, Dr. Nguyen, but when you shared in one of your talks that when I call my insurance company to whatever, ask them, is this doctor in my network, or how come you're not covering this payment, or I need to get this medicine covered, whatever it is, that you, Dr. Nguyen, that you're calling the same number I'm calling. Like, I had no idea. You're calling the same number I'm calling. You're getting put on hold by the same people, and you're sitting on hold as long as I'm sitting on hold. That's unbelievable to me. I heard Maureen say yesterday, God, I know I'm going to misquote it, but it was some extraordinary, she was like, doctors would, with AB1400, doctors would get back something like 85,000 hours a year. Like it is an extraordinary amount of time that our doctors, not their staff, that the actual doctor is spending on hold with the insurance companies, begging for them to approve a test, a procedure, a medication for their patient that the doctor feels that the patient needs. And I know that you also shared, Dr. Nguyen, that the person that makes that decision, because it doesn't get to be you, because you don't have the freedom. Right now in the United States of America, our doctors are not free. Their hands are bound. They are dictated to what they can give their patients. And so, and you said that the people that are making these decisions of what you can give your patients are people who have not talked with your patient, not seen their chart. A lot of times they're people who have been retired for a number of years. And as we know in science, so many things changes. And so yeah, do you want to just share a little bit about that? Because I still find it so shocking. And I think really pointing out, Dr. Nguyen, how you're not free in the United States.
Yeah, it's a great point. And I don't know the exact number. Obviously, Maureen knows it, but I'm not surprised by that number, that several thousands of hours would be available to doctors if we didn't have to go through that ridiculous process. And I'll answer your question with a story. As you know, I always like to relate my own personal experiences with patients to kind of illustrate what happened. So about 2 months ago or 3 months ago, I saw a patient and we made a diagnosis, and she needed to be started on a very specific medication. And I knew that this was an expensive medication. I knew that it was something that oftentimes is very difficult to get prescribed and to have the insurance companies pay for. So I did my due diligence. I wrote the most complete note that a person can, illustrating why she needs to take this medication, what sort of benefits she'll get from it. I added links on my note to primary medical literature, justifying, you know, sort of my rationale, and essentially saying that with this disease, this is standard of care. This is what she should be taking, right? And of course, you know, I prescribe it, and you know, 2 weeks go by, I call the patient, I said, hey, you know, did you get the medication yet? It's a medication that needs a special pharmacy, so you'll be delivered the medication. He says, no, I haven't. So I said, okay, let's, you know, I knew this was going to happen. So I said, okay, we'll follow up on it. So we call the pharmacy. Pharmacy says it hasn't gotten insurance approval yet. I said, okay, it would have been nice if you told me this, but that's fine, you know. And they said, well, sometimes it takes them a while. I said, that's okay. And so then, you know, we called the insurance company. We said, what's going on here? Oh, it's still going through the approval process. This will take some time. I said, okay, well, keep us informed. Let us know. Another couple of weeks go by. Call them back again. You know, and each time I make a call, it's probably about anywhere between 30 to 45 minutes of wait time each time. Call them again. You know, what's going on? I have the authorization numbers. I have the patient information. I go through the whole process again. They send me through the phone tree. And once again, I finally get to a real life person. And they said, oh, you know, it hasn't gone through the approval yet. We'll let you know in 72 hours. I said, okay, 72 hours go by. I hear nothing from them. I call them again. Another 45 minutes spent. And finally I get a real person again, and they say, oh, your medication is not approved. And I said, why? And they said, well, you're going to have to do, I can't speak to you about that. You're going to have to talk to they call it a peer-to-peer. You have to talk it to someone who's authorized to discuss the case with you. And so let me set up a time. I said, you know, this person really needs this. They're very symptomatic. We need, you know, they're not taking anything for their disease at this point in time. I said, okay, we'll set up an urgent peer-to-peer. I said, okay, so another 72 hours go by. I hear nothing from them. I call them again, and they say, oh, sorry, we didn't get back to you. Your peer-to-peer scheduled on a later date. They give me the date and time, which happens to be another week later. So now I think it's been about a month or so that's gone by. Patient still doesn't have any medication. She's calling me saying, what's going on? And I'm saying, I'm sorry, we're going through this whole process, right? So finally, I talk to the peer-to-peer. I tell them, you know, all the patient information. I tell them all the medical literature that I've gone through, what her diagnosis is, how does she qualify for that diagnosis? Everything's laid out for the person. They said, you know what, this is beyond my scope of practice. So I'm gonna have to talk to my senior advisor. So I said, okay, can you just connect me to your senior advisor person, your pulmonologist, and I can talk to them and they'll understand what I'm saying. They said, okay, sure, we'll get back to you. Another couple of weeks go by, same process goes over again. Finally, 2 months after I wrote the prescription, we got approved. I made 0 changes to my note. I told them nothing new, nothing had changed. Everything stayed the same. It took 2 months for this poor lady to get the medication that she needs. That means 2 months without treatment. This is not uncommon. This happens very often. I knew this was a potential of happening. And it would have taken longer if I hadn't already put all of that information in my note from the get-go. It would have been 3 months or 4 months. But this is all the time. So yeah, when we write a prescription, someone who's never seen the patient can deny it. Someone who may not even be a pulmonary specialist, so I'm a specialist, someone who doesn't even have the type of training that I have can deny it. And then the funny thing is they'll always say, well, can you take XYZ medication instead? And it'll be completely like not even the same medication. It wouldn't even be in the same, you know, category. But that's how they want to work, right? They want to give you the cheapest medication so that they don't have to pay for it, and because they don't really care, you know. But that is what happens.
That is unbelievable. I cannot believe how hard you had to fight. Go ahead, Dr. Nguyen.
I forgot. So in the meantime, my patient, I forget, we got approved 2 months later. At about a month and a half, my patient actually went out and bought the drug from Canada with her own money. things you have to do for your health, right?
Yeah, and I can see, you know, how choked up you are and how hard you had to fight. And look at that, like, why did you have to justify anything to anybody? You are the doctor. You should have just been able to write the prescription for your patient and have that prescription be filled. And so, and I don't know that all doctors fight as hard as you do for their patients, Dr. Nguyen. So whoever gets you as their doctor is beyond fortunate. And I can understand why the burnout is so high. I mean, that is, it's demeaning. It's unbelievable. So thank you so much, Dr. Nguyen, for everything that you're doing and being here with us today and in this fight and sharing this. So we are going to go ahead and close. It's right at closing time. So we started off by talking about this bill is only going to pass if every one of us fights for this bill. We need you to call your assembly member. If you don't know your assembly member, Paul will drop in the Facebook chat again how to find your assembly member. You can just go to Google, find My California Representative. You'll get a website, you put in your zip code. Call your assembly member, tell them to support AB 1400. Text bank with us. We're having one tomorrow night from 6 p.m. to 8 p.m. Paul will drop that chat again, or that link in the chat again. Check us out at hcala.org. We have a calendar of events. We are working in solidarity with every group you can think of. PDA, California, Dr. Bill is here. There's going to be a town hall in November. We have on our website under Take Action, a CalCare toolkit includes also everything the nurses are doing. We are going to be out there tabling. We need your support with that, with DSA LA, Feel the Burn San Fernando Valley, and so many other organizations. So get active. Thank you for joining us. And you know what, if you liked this, put 5 on it. We need money for flyers, to run the website, things like that. So go to hcala.org and check that out. We will be back on next Sunday, October 24th, 5 p.m. to 7 p.m. So join us next Sunday. The Sunday after that is Halloween. So I think we're going to take off Halloween. But with all of that, go AB 1400. Thank you, everyone. Paul for running the tech. Dr. Bill, I think you've been to every single CalCare office hours, and you run your own PDA, Medicare for All Town Hall also on Sundays. You are amazing. Dr. Nguyen, we love you like crazy. Danette, you know, I see you out there all the time fighting the good fight. You know, Gina Harris, we missed you. Big love and big hugs to you. Can't wait to have you back on. And to everyone who wasn't on today, everyone who joined us by Zoom, thank you so much. And everyone who's not on but fighting the fight, mwah, love you. Thank you. Good night.